so now we're going to do a skin assessment. So first I'm going to assess Reagan's scalp and hair. I'm going to ask her if she's wearing a wig, which she's not. And I'm going to just look through the hair and look at the scalp, looking for any infestations she doesn't have, or lesions, bumps, bruises, redness. You could look for patches of psoriasis or dry skin, which she doesn't have. Make sure the hair is, see if it's brittle or feels healthy, which it does. Also at this time, look behind her ears, make sure there's no bruising or bumps or bruises behind her ears. Then I could inspect her face, on her skin on her face, and she's little, so she does have some freckles, which is a type of lesion, but other than that, her skin is smooth. I would just start from her head to her toes, but for the purposes of this video, we'll just do what we can see. So we want to make sure her skin is warm, which it is. My hands are cold. Dry, which it is. Intact. Also, want to check her skin turgor. So if I can see your arm, put your palm down, that, and you want to just pinch the skin, and this can be the sign of dehydration. Checking the skin elasticity, which she's also little, so she has great skin. And then I could also inspect her fingers and her nails. So her nails are blanchable. Her cuticles are round. There's no clubbing, which is sometimes a sign of pulmonary COPD can cause clubbing in the fingers. I would also want to inspect if Reagan was bed bound or wheelchair bound. Would want to inspect the parts of her bodies that is laying on the surface for a while. So her sacrum, under her bottom, make sure that there's no erythema or breakdown there. If she's laying on her back, her shoulder blades, her bottom, the bottom of her heels. What else? Also, we could check for edema, so 0 to +4 edema or pitting. So we could just press on her skin in the area that may look swollen and how many millimeters that it goes down, which she obviously has none. What else? We also want to just check throughout the body for cyanosis, so make sure she's not blue. Jaundice, make sure she's not yellow. If the whites of her eyes were yellow, that would be a sign of jaundice or hyperbilirubinemia. And erythema, so any redness. And I would just start from her scalp and go to her toes, so head to toe, front and back, check all the areas of her skin. And if I was doing this in a hospital setting, then I would want to do this at the time of the bed bath, or just assess the skin at any point that I'm working with that particular body site. So skin assessments can be put in with other assessments so that you don't need to strip your patient down and check their skin when you could do it with other things. So yeah.